Boom. Hi, I'm Dr. Nikita Vizniak with the amazing,
Dr. Catherine Chung,
and today we're going to be talking with you about what diet, Dr. Chung?
the DASH diet, DASH.
What does this DASH diet even mean? I don't even understand it.
It stands for dietary approach to stopping hypertension. So
All
it's a
right.
very specific diet for hypertension.
All right, excellent. So this, of course, is in one of our nutrition books here, where Dr. Chung is a major contributor talking about eating for optimal health. We will just go to our DASH diet here, if I can find my way there. Boom, DASH diet.
First diet on the
There
list.
you go. Yeah. All right. I will just say right off the bat, I love this diet. It is absolutely fantastic. Designed for hypertension. The research is clear. This diet can potentially reverse hypertension and make it so you may not require medication to actually control your hypertension. So the first thing is maybe what are normal hypertension numbers, Dr. Chung?
So normal hypertension numbers is anything above 120 over 80 technically, but you do have some leeway. Usually what I see is if it's between 120 and 130, it's more like pre-hypertension. And then anything above 130 is hypertension and above, essentially. And there's different staging based on how bad it is. I will say that it's based on an average number. So say one day you had a
Mm-hmm.
stressful day and then your blood pressure was at like 150 over 100. That doesn't mean you have hypertension. It's just you had a hypertensive event.
Yeah.
So it has to be an average over 3, 4 days where you take it consistently. And over those readings, that's what, and you see that you do have a consistent high blood pressure, then you can be diagnosed with hypertension.
Yeah. In our clinics, we recommend six readings minimum in order to get
Yeah.
an accurate number. And then the other issue with it too is your blood pressure increasing if you are exercising or anything else like that. That is a normal response. You should see an increase in blood pressure as your cardiac output increases. If your resting
Correct.
blood pressure is high, that becomes an issue.
Yes. Yeah. Yeah.
Absolutely. All right. Let's get back to this DASH diet and the specific sense. So what are our guidelines on this DASH diet here? What do we have to follow?
Well, and I love that word that you use, Dr. Nick, guideline, because the DASH diet isn't really a diet. It is more like a guideline. It's a lifestyle approach that you want to take with your food. So a lot of it is you're going to be low on certain foods and then you're going to be super duper high on others. So when
Mhm.
you look at this list, there are zeros, but it's not like a hard zero. It's zero, it's a range, a 0 to 2 for alcoholic beverages for men or 1 for women. But even meat, 0 to 6, it doesn't mean that you have to completely be protein free or mammal free. You
Mhm.
just have to be on the lower side, or the portion is smaller, right? But I love focusing on the things you are allowed to eat, because
Mhm.
when you think of things like, oh, I can't have that, I can't have this, it's not very positive and it doesn't really motivate you to want to follow whatever you're doing, right? So with the DASH diet, you're going to be high on the whole grains, the veg, and the fruit. And the reason for that is because they naturally have low sodium and they
Mhm.
naturally are low on saturated fat as well.
Yeah. And so there's a couple of key things there. This diet originally was designed as a vegetarian diet, but in order for it to be more palatable for the general population, adding small portions, and again, the key thing is controlling your serving size of meats, of alcohol, of sweets, makes it a doable guideline or diet choice for you to follow. And I think one of the bigger things people should recognize as well is this limited sodium intake. That is foundational around this diet, right?
Mm-hmm.
Yeah. So watching this right here, even the American Heart Association recommends even a lower intake of salt than we recommend in the DASH diet. But both have been shown to have benefits reducing sodium intake potentially. There's even an association with cancer risk of the stomach, I believe it is. We talk about, yeah, over here. Yeah, one of our references there is giving us that. All right. So what are the therapeutic uses of this DASH diet?
Well, of course, we already chatted about how it's really good for hypertension. The reason why I love the DASH diet is because it has a lot of other positive side effects outside of just dealing with your hypertension. So it's actually really great for cardiovascular disease, mainly cholesterol issues. And it's just because it's so similar to the Mediterranean
Mhm.
diet. And then it has really positive effects for your weight loss journey, but also blood sugar regulation. Again, because it's very similar to the Mediterranean diet, and also you're focusing on foods that fill you up with low calories or
Mhm.
low amount of calories. So you just feel fuller for longer, and that's naturally where you will lose your weight from, essentially.
Yeah, and I thought you brought this up really well before because we were talking about how the diet works. And if you look at it, we're looking at North American reference ranges here. We're looking at anywhere from 60 to 70% of the population is overweight or obese beyond normal weight limits where we should be for healthy weight and optimal health. You brought up the term in a previous video, calorie density. Tell us more about that.
So calorie density is where you are eating. Well, it's a range, I guess. So the amount of calories in a food and how much room it takes up in your stomach. So what you want to really focus on is things that take up a lot of room in your stomach, that are calorically limited, and then you mix it with a little bit of amount of really high caloric foods that take up less space. So that's where the food
Mhm.
combination comes from. So then at least you naturally will have a lower amount of caloric intake, but
Yeah.
you are feeling full or nourished from that.
And I think that's what a lot of people don't realize. I mean, the number one way that you're going to lose weight is calorie restriction. And a great way to do that is by filling your stomach with other good things that are going to offer you not necessarily calories, but other micronutrients you need for your body to function optimally.
Yeah. And even if like weight loss isn't your goal, but reducing your hypertension is your goal or your patient's goal, it's exactly what Dr. Nick was talking about, where high blood pressure will occur if you have an increase in cardiac input or output. But if you have extra weight that you have to
Hmm.
carry around, that will naturally increase the cardiac output. So if we want to reduce hypertension, we have to reduce the output that your heart has to put out, just to survive or to move your body on a daily basis.
Absolutely. And a lot of people don't realize this. I talk about this with some of my bodybuilding patients in particular. Like if you're overweight, you are carrying extra kilometers of blood vessels that your heart has to squeeze blood through. Well, it's better if it's lean body mass, but it's the same thing for bodybuilders. As you get bigger and larger, your heart effectively doesn't increase in size that much unless you have a hypertrophic cardiomyopathy or something like that going on. And even then, that leads to other issues. But back to the main point here, the bigger your body gets, the harder your heart has to work and the more difficulty it can have. And this DASH diet is a way that you can decrease cardiac load potentially over time.
Yeah, and that's something that is important to highlight with our patients as well as clinicians, right? Because sometimes that's not a goal that they have, and they feel judged around. Oh, well, are you telling me I have to lose weight then? Like, what are you inherently trying to tell me, right?
Mhm.
Versus if you kind of change the perspective on it, where it's not about weight loss, that's not the actual goal, but understanding the impact that a little bit of excess weight may have on your body, changing that framework will be more palatable for a lot of people too.
For sure. Once you can relate it, so number one, back to heart disease and all that, but number two, if you can relate it back to mood and overall self-effect and their own personal belief and their abilities and everything, like even for myself, if I'm weightlifting a lot, I'll get up to 180 pounds. But if I drop down, like right now I'm 165, I feel light, I feel fast, I can move better, I can think better. Like all of these things come together. All right, back on
Mm-hmm.
the DASH diet specifically, we should talk about some of the risks. Well, I may mention one other thing here that's key as well. So cardiovascular benefits, also potentially reducing your risk of type 2 diabetes with this diet as well. Very similar to the Mediterranean diet that we've seen before. And of course, potentially it won't really happen in North America or developed countries where you have iodized salt, but because your salt intake is so low, you might potentially be looking at iodine deficiencies.
Yeah.
Yeah.
And that's only if and if you read that last bit there, if it's you're following more of a fully vegan or
Yeah.
vegetarian diet, because there is iodine in like fish or like
Mhm.
kelp or sea veg and all that stuff, right? So it's a really specific subsect of dietary parameters.
Yeah, yeah, absolutely. Exactly. Your risk of this is super low on the diet, especially if you're having any kind of animal-based protein. All
Yeah.
right, so we also look at some supplementation here, iodine potentially, but we've kind of already talked about that. Flaxseed
Yeah.
potentially. And
Yeah,
this is
definitely. Follow the first two are great and
mhm.
safe for more or less everyone. The last one is the one where it can really throw off your thyroid. So definitely don't go down that route if you do not have
Mhm.
iodine issues. Like it's really specific for iodine deficient patients. So or people. So don't just go put yourself on iodine, is what I'm
Yeah.
saying.
Well, yeah, exactly. And the thing is, that would be an extremely rare circumstance where that would actually come up. So, all right. And then we have a picture right here just of what it would look like on a plate of the overall DASH diet, things that you want to avoid. Again, it's avoid, not eliminate. You're looking at smaller serving sizes of these things and then making it a daily habit that you can actually follow through with. Anything else you'd add to this one, Dr. Chung?
No, I think it's one of those diets I love because it's very generalized. So even if you're not 100% at it, you're just like, you know what, I'm gonna follow it at like 85%,
Hmm.
75%. It's gonna have such a positive impact on how you feel in your body and how nourished that you will feel that that's why I'm like, it's not really a diet. It's more just like a lifestyle guideline, to be honest.
Absolutely. And even the fact that we're using the term DASH diet all the way through, really just call it, yeah, this is an idea that you might want to follow. If you look at the research too, it is the second most recommended diet, not recommended, second best diet recommended by the American Dietetic Association, second to the Mediterranean diet. And they are just so
Mhm.
similar. So I would strongly encourage it for any patient. Anybody can have benefits from this one. So,
Yeah,
all right.
exactly.
All right. Well, thank you very much for your time, Dr. Chung, and we'll see you all in the next video.
Thank you. Bye.
Bye, everybody.